you told me this story about somebody getting an incentive many years ago, an incentive program when it was introduced.
Yeah, I got to practice in a really good environment at HMO that I felt gave terrific care, but for some reason it decided in the wave of pay for performance, value-based payment, early stages of it, to start rewarding us or not rewarding us depending on our performance. And I remember walking by the open door of one of my colleagues, Mark, who was a lovely pediatrician and just great. He was a specialist in lead poisoning. He was so proud of it. And Mark was leaning on his head on his hands like that with a piece of paper between his fingers. And I said, "What's up, Mark?" And he held up the piece of paper, which was his $300 bonus check for that quarter for his performance. And he said, "I feel so misunderstood." Comment on that? What do you hear?
I mean, the story is the same, isn't it? The incentive is the care of the patient. If I could do something differently to serve the patient, you think I wouldn't have already tried it? It's no amount of, more money or more retirement compensation or whatever that looks like, that incentive looks like, is gonna make me be able to move a system, to move mountains.
How does it make you feel to be stuck in that?
Feels great. I think one thing I've talked to you a lot about is that I think I love this job. I've said I love this job. It's really true. And I don't know that I could still be doing this job without the community of people who I sit within who really understand it. I have these colleagues who, in particular, a group of 3 women who is a place that I need to go to. I need that space.
It's your community of support.
I have many layers of communities of support, but I know that I can always text, call these 3 peers and say, "Can you believe this?" And that they will understand it. That community, in my mind, is absolutely essential.
Are you a fan of this unionization wave?
I think it's a necessity. A fan is a funny word to use because in some sense, I really don't think it's an option. I think if we, I'm not a primary care doctor because I don't know that could be. I think the job is too hard. Right now, we ask the primary care doctors to be responsible for preventative care, for acute care, for chronic disease management, for increasingly complex patients in less and less time. And then we ask them to complete more documentation, and we increase access to them by the patients, which is not, of course, in and of itself a bad thing, it's a good thing. But there are only so many hours in a day, and unionization to me is a necessary, if the collective action piece is the only way I understand to counter the forces here, to say, hold on. We're trying to give good care to our patients. We have to come up with ways to make that possible.
Instead of more difficult. Well, I want to move to the